searching for answers. The number of global infections from coronavirus grows to more than 800,000. We have team coverage, including how lawmakers and the White House are responding. And whether doctors in Rome are having any success against the deadly outbreak. Closed indefinitely. One of the most holy sites in the world is not open to pilgrims for the first time in hundreds of years. And Christ on the cross. Why Pope Francis is asking the faithful to think about Jesus and his crucifixion. On EWTN News Nightly for Tuesday, March 31st, 2020. Good evening and thanks for joining us tonight. I'm Tracy Sable. More American cities are feeling the impact of the dreaded coronavirus. Some are even issuing mandatory orders for people to stay home. New York has been the hardest hit, but other communities are also on high alert and hunkering down for what promises to be an April like no other. Correspondent Owen Jensen reports.
As the nation reels from COVID-19, at the White House,
challenging times are ahead for the next 30 days, and this is a very vital 30 days. We're sort of putting it all on the line. This 30 days, so important because we have to get back.
And the end game?
The more we commit ourselves now, the sooner we can win the fight and return to our lives, and they will be great lives.
In New York, this plea to healthcare workers.
If you don't have a healthcare crisis in your community, please come help us in New York now. We need relief.
The nation's deadliest hotspot with over 1,200 deaths statewide, the majority of them in New York City.
You're never too sure about anything.
In the Midwest, a health expert says Detroit has become a hotspot.
The demographic of Detroit includes a substantial elderly population. And so when you combine all these factors together, it's really a formula for creating a population that's really primed to be at high risk for a disease like this.
And in the South, Texas is ratcheting up restrictions on neighboring Louisiana, one of the growing hotspots. And out west, an ER doctor in San Francisco remains hopeful.
And I think, quite honestly, the shelter in place and the social distancing is working because that surge has yet to come. We're all kind of together holding our breaths.
For now, the multi-trillion-dollar fight continues. President Donald Trump tweets, the next coronavirus relief bill should include money to rebuild America's roads and bridges. He writes, with interest rates for the United States being at zero, this is the time to do our decades-long awaited infrastructure bill. It should be very big and bold. $2 trillion and be focused solely on jobs and rebuilding the once great infrastructure of our country. Owen Jensen, EWTN News Nightly.
Another lawmaker on Capitol Hill has been diagnosed with a presumed case of COVID-19. So far, at least 5 members of Congress have tested positive and more than 24 others are under self-quarantine. Correspondent Eric Rosales continues our team coverage tonight from Capitol Hill. Eric?
Well, Tracy, the latest lawmaker is U.S. Representative Nativia Velasquez, a Democrat from New York. In a tweet, she says that her symptoms are mild and she is currently self-quarantined and under the care of the Office of Attending Physician here at the Capitol. Meanwhile, those who live in the Washington, D.C. area, they've been told to stay at home. To say Washington, D.C. looks like a ghost town is an understatement. The leaders of the nation's capital, Maryland and Virginia, announced stay-at-home orders on Monday as the number of coronavirus cases continues to rise in the capital region.
Under this order, everyone in Virginia must remain in their place of residence unless they must go out for food, supplies, work, medical care, or to get fresh air or exercise.
And some predict the area will soon become a hotbed of outbreaks in the weeks ahead, just like New York is experiencing right now. Inside the Capitol, the halls are empty except for police and cleaning crews who tell EWTN they are scrubbing it from floor to ceiling. Although the House and Senate are in recess, lawmakers are still working on legislation. Last week, House Minority Leader Kevin McCarthy says Congress must take a closer look at the nation's medical and medicine supply chain.
As we're working trying to get the PPEs for the hospital,
China controls too much of our supply chain. Congress has too much control of the ingredients that will go into our medicines, too much control of our medical equipment.
Statistics show China accounts for 95% of U.S. imports of ibuprofen, 91% of hydrocortisone, and 70% of acetaminophen. According to Commerce Department data, in all, 80% of the U.S. supply of antibiotics are made in China.
As a nation, we should redirect that and make sure that we can take care of ourselves and not be put in this situation again.
The Trump administration and lawmakers are calling for a dramatic revamping of U.S. drug manufacturing operations. Lawmakers tell me that we can't rely on other countries, especially when it comes to our health. Tracy?
Okay, thank you, Eric. Correspondent Eric Rosales reporting from Capitol Hill. Well, in a time of social distancing, packed prisons pose a risk for viral outbreaks. One example, Rikers Island Jail Complex in New York City. The New York Times reports the jail has more than 167 confirmed cases among inmates. Correspondent Mark Irons joins us now in the studio. Mark.
Tracy, in order to prevent outbreaks like that, some jail systems across the country have released inmates to decrease and slow the spread of the coronavirus, but it has brought controversy.
I'll tell you when we're coming out of the battle. Right now, the toughest weeks are still ahead.
New York City Mayor Bill de Blasio acknowledges the coming challenges posed by the coronavirus. The mayor said city officials have released about 650 inmates serving a year or less for nonviolent offenses.
I can update you and say that since this crisis began, our jail population is down by about 860, not just because of the releases, but because we've seen falling crime and lower arrests.
Los Angeles County, home to America's largest jail system, has released nearly 2,000 inmates to try and prevent a spread.
And we've lowered the jail population by roughly 10%.
In places like New Jersey, South Carolina, Iowa, and Ohio, authorities are working to release detainees accused of low-level crimes. And while some states have issued stay-at-home orders, the government argues some prisoners should stay in jail. In Texas, Governor Greg Abbott has issued an executive order preventing the release of certain prisoners. He tweets, "We want to prevent the spread of COVID-19 among prison staff and inmates, but releasing dangerous criminals in the streets is not the solution." At the Vatican on Sunday, Pope Francis called for world leaders to be sensitive to the serious problem of overcrowded jails where the coronavirus could run rampant. The pandemic has rallied a national effort to battle the virus with healthcare workers on the front lines, and evidence shows some prisoners are joining in the fight. These inmates in East Tennessee work at a textile plant in their correctional facility, making protective masks for medical staff. Over 1,000 of those masks have been shipped out to be distributed in areas most in need in Tennessee, and one inmate working on them is quoted as saying, "The way I see it, I'm saving lives, and I couldn't be more proud to be a part of this." Tracy.
Okay, thank you. Correspondent Mark Irons reporting for us tonight. Well, the coronavirus continues to spread not only in the United States, but also around the world. In Iran, the death toll is drawing close to 3,000 people. A spokesman for the health ministry says there are nearly 45,000 cases of the coronavirus in the country. The streets are deserted and shops are closed. Officials are enforcing travel restrictions and prompting social distancing. The head of the church in Burkina Faso has tested positive for COVID-19. Cardinal Philippe Ouedraogo is the second cardinal known to have tested positive. The 75-year-old reportedly is in good condition and is in self-isolation. Well, Italy is seeing a decrease in the rate of new confirmed COVID-19 cases while registering a record number of people cured.
To get down from the numbers, not just stabilize, requires a redoubling of public health efforts to push down. It won't go down by itself. It will be pushed down. And that's what we need countries to focus on.
According to the World Health Organization, it is not the time to lighten up tough measures to limit and track the spread of the virus. Italy is currently the country with the most deaths due to the pandemic, with over 11,000 people. Today, Italy and the Holy See flew flags at half-staff in honor of those who have died from the coronavirus. Dr. Marta Ciofi, head of the epidemiology clinic at the Vatican's Bambino Gesu Children's Hospital, joins us now from Rome. Thank you so much for joining us, Doctor.
Thank you. Good evening.
Well, I know that doctors and hospitals, as well as other healthcare workers, are doing all they can to care for and also stabilize the patients that are infected with COVID-19. But what about the nurses and doctors? How are they coping physically and emotionally? It must be really hard.
Yes, for sure. It's a period of extreme stress for healthcare workers. So there are a set of things that we have to do to cope to this pandemic. And first of all, we have to find the time to sleep, to eat, to drink. So it is very important to organize shifts in a way that we have enough time for breaks. And second, it's important to share our feeling and anxiety with family, friends, and loved ones, to share this very unusual experience. And third, we have to be very strict regarding procedure for infection prevention and control, to be safe and to have our family safe and people around us safe. And this is very important in terms of training and maintaining control.
Have we learned anything new about the virus in recent weeks? Anything that may help to stop spreading it?
We know that this virus is transmitted by droplet and contact. The very important thing is that we are all susceptible to this new virus, so this is why it can spread so rapidly and widely. Since we do not have any vaccine yet, we have to adopt these non-pharmaceutical measures such as hand hygiene, personal protective equipment, and prompt isolation of suspected patients and their contacts. And this is why there is so much work on having new tools for fast identification of patients, such as virological testing that can give us results in a very short time, in 1 hour just. But this is very important to have dedicated ways of suspected patient to enter into the hospital and to be tracked, isolated, and maintaining isolation during their in-hospital stay.
Doctor, do you think the pandemic will change the way the hospital procedures, how hospitals operate in the future?
Yes, I think that we are learning a lot from this experience, and for sure, preparedness to emergent infectious disease will be enforced, has been enforced strengthened by this experience, and also tools such as telemedicine or artificial intelligence are even more important in this setting. Particularly telemedicine is very important now, since there is a reduction of access to hospitals, and we can take care of patients, for example, with chronic conditions, using tools for visiting them and treating them by a distance. And for sure, this will be maintained and reinforced in the future.
Well, Doctor, thank you so much for your time and your insight. We really appreciate it. Dr. Marta Ciofi, the head of epidemiology clinic at the Bambino Gesu Children's Hospital in Rome. Thank you.
Thank you.
Well, the Church of the Holy Sepulchre, built on the site of the tomb of Christ, is closed indefinitely. It is the first time in nearly 700 years that the church closed for an extended time due to disease. Initially, the closure was expected to last only 1 week, but now there is no timetable for it to reopen. At least 3 priests have been arrested in Uganda after they celebrated public Sunday Mass. The masses were in defiance of government orders banning religious gatherings during the COVID-19 pandemic. At least one of the priests has since been released. Officials say the Trump administration is preparing to lift sanctions on Venezuela. The proposal was announced today by Secretary of State Mike Pompeo. It suggests forming a transitional government, including allies of both President Nicolas Maduro and opposition leader Juan Guaido. The democratic framework for Venezuela echoes a proposal made by Guaido over the weekend. Coming up, analysis of the mayor of New York's comments about closing houses of worship. And and a memorial mass for Terri Schiavo on the anniversary of her death. A threat by New York City Mayor Bill de Blasio to, quote, permanently shut down houses of worship that continue to hold public services has religious freedom advocates on alert. De Blasio made the comments Friday, warning that religious communities continuing to hold services in violation of the city's ban on gatherings of any size would have those services shut down. The mayor went on to say those congregations could be subject to additional actions, including fines, as well as potentially closing the buildings permanently. Joining me now by Skype to talk more about this is Montse Alvarado. She is Vice President and Executive Director at Becket, a nonprofit law firm dedicated to protecting religious freedom. Montse, good to see you. Welcome back.
Good to see you too. Thank you for having me.
Absolutely. So what do you make of Mayor de Blasio's comments?
You know, there's no way that what he actually meant to say is permanent closure of churches, synagogues, mosques. These religious entities are never going to be closed permanently. The First Amendment, no matter whether we're in a national crisis or not, a global pandemic, it still stands. In the United States of America, our First Amendment freedoms continue to stand.
Well, Catholic churches in the Archdiocese of New York and the Diocese of Brooklyn, which covers all 5 of the boroughs in New York City, suspended the public celebration of Mass earlier this month. However, there are other faiths that are continuing to hold these services. You touched on this, but do they have the right to do that despite the social distancing guidelines?
In moments of national crisis, the government is allowed to use its emergency powers to make sure that we're all safe. That's a legal principle that we call compelling interest. But at the same time, those emergency powers that are given to the government are temporary. So we have to remember that that's a temporary reality that we have to check when all of this is over. We had a great reference to this in the New York Times today, where they were talking about some of the emergency powers that still exist for the government after 9/11. Those are things that should not be. And so yes, the government has an interest in keeping us safe and keeping us healthy and making sure that our communities aren't spreading this virus. That is true. But at the same time, they have to create these laws aware of the needs and the essential realities for these religious communities. So these are also essential services. Going to confession for Catholics is something that should continue.
All right, well, another big talker just yesterday, the pastor of a church in Florida turned himself into authorities after detectives say that he held 2 Sunday services with hundreds of people and violated a safer at home order in place to limit the spread of the virus. That pastor, Rodney Howard Brown, calls his ministry, quote, an essential service and says that social distancing guidelines were practiced. I know you heard about this. What are your thoughts?
You know, these are moments where everyone is doing their best. And we're all shooting from the hip because we don't want to be caught with our pants down in the middle of a crisis, right? So the reality is we're doing everything we can to pull and to get everyone to come together. And in order to do that, sometimes you're going to make an example out of people. And it's not the best thing to do. We need charity and grace in these moments where religion and government are coming together to solve the crisis. You're seeing some beautiful realities of that. Some wonderful people that are using their religious ministries to create masks for people, or using some of the resources that religious communities have to feed people who are living hand to mouth from their schools. The reality is that this is the moment for us to have that charity and have some conversations before we're making arrests.
Well, Montse, thank you so much for coming on and for sharing your insight with us. We really appreciate it. Montse Alvarado, Vice President and Executive Director at Becket. Thanks again.
Thank you.
And a reminder that you can always watch our daily masses right here on EWTN. Mass is broadcast each day at 8 a.m., noon, and 7 p.m. Eastern. We're also airing the Pope's daily Mass as well as the Novena from Our Lady of Lourdes. In addition, we are offering Eucharistic adoration from 9 a.m. to 6 p.m. Eastern on our website, EWTN.com. Today is the 15th anniversary of the death of Terri Schiavo, a Catholic woman who died 2 weeks after her feeding tube was removed at the request of her husband. A memorial mass was held in her honor in Michigan.
Let us pray it won't happen again. Amen.
Father Timothy Nelson celebrated the Mass in Jackson, Michigan. He says the Diocese of Lansing is working with several groups to establish a health center in Schiavo's name. Up next, analysis of several states' attempts to curb abortions during the coronavirus pandemic. And Pope Francis says something good can come to the faithful when we look at a crucifix. We'll explain. Amid the deadly coronavirus outbreak, officials in the United Kingdom say they will permit women to perform medical abortions at home until the pandemic ends. Pro-life groups aren't happy. They say medical abortions are dangerous for women. The UK government previously said that it would not permit the procedure. Meantime, here in the United States, federal judges in Texas, Alabama, and Ohio have temporarily blocked efforts to stop abortions during the coronavirus pandemic. The rulings follow measures taken by lawmakers in those states to include abortions in bans on non-essential procedures. Joining me now by Skype is Jorel Gonsi. He is the president of Heartbeat International, a nonprofit interdenominational Christian association of faith-based pregnancy resource centers. Jorel, welcome to the show.
Thanks, Tracy. Glad to be with you.
Jorel, so what are your thoughts on abortion providers still being allowed to operate during this time?
Well, of course, it's crazy as we're getting reports that there are abortion clinics that are basically packing women into reception rooms, completely avoiding social distancing. But on the good news, there's our pregnancy centers are still opening. They certainly are essential services. Our own option line .org is getting calls at a record rate. We had a 38% increase in contacts just in the last 2 weeks since the whole kind of COVID crisis has descended on our nation. So women are looking for help, and they're finding pregnancy centers that are doing a great job in adjusting services. In some cases, they're moving some non-essential services kind of online, but still trying to figure out ways to serve their community and to impact women who are in that at-risk community, and also at risk for abortion, that is, and also who are really in making a life and death decision. A lot of these women are headed to abortion clinics because they can see no other option, and pregnancy centers are there doing exactly that, providing life-affirming options to those that desperately need hope at this point in time, like we all do.
Jerome, are the stay-at-home orders across the country, are they affecting the work that you do?
Well, absolutely. Certainly here at Heartbeat, I'm in an office by myself right now, but our option line team in particular and our abortion pill rescue network are all operating remotely. They've been able to do that for many years now. So for them, it's not been a big adjustment. For our office team here, it has. But the local pregnancy centers are impacted greatly because they really thrive on that close relationship of connecting people one-to-one. And of course, the whole social distancing has kind of created some hiccups in that ability to serve. So they're adjusting their services. They're talking to people more on the phone. They're looking to find ways to connect with Skype and Zoom and things like we're doing right now. But they're also trying to find ways even to change how they deliver services. I just learned of several centers that are not just putting out, say, key material items, diapers, formula, some things that are needed in this critical time that are not as available as they normally are, but they're actually delivering them to local, to their own clients. They're dropping them off so they can really show that love of Christ the way that that we can do in this time frame.
That's beautiful. I love to hear that. I'm curious, you mentioned some of those supplies like formulas and whatnot. Has your center felt the impact of the supply shortage that many Americans are dealing with, or maybe also the shortage of masks and things like that?
Well, certainly. Most of the pregnancy help centers are medical and they provide ultrasound services. So their ability to kind of quickly adjust to some of the medical care has been a challenge in certain places. Obviously, in the places where such things have been locked down sooner rather than later, has been a little more difficult to adapt to, but the centers are doing great. They're implementing some services like protocol adjustments where they're only, say, allowing one client in at a time to be able to get their ultrasound so they can see their baby live on the screen, and then to minister that life-affirming service. So they're doing that with care, cleaning between everyone. So a lot of new protocols for us for this crazy time where we don't want to be at all participating in the spread of the virus, but we still want to continue the life-affirming service that is essential in these communities.
Yeah, and no doubt this is a very trying time for all of us. What would you say to those women who are pregnant and maybe unsure of what to do? Do you have a message of hope for them?
Well, that's just it. There is hope that this is not an easy decision to make under any circumstances, and even more difficult in these times. But the reality is life is wonderful. We are championing life at every point. And even as we value each other's lives by social distancing and by doing things that keep us from spreading something that might cause death, we also want to bring life into this situation. So life can be part of the plan as a woman is facing that. As if someone is facing that kind of decision, they can realize that there are people there that are able to help them at no cost to them, to serve them, to love them, to walk with them through every step of this process, to see really the gift of life in action, and honored and blessed.
Well, Jarrell, thank you so much for joining us, and thank you so much for what you do. Jarrell Gonsi, president of Heartbeat International.
Thank you, Tracy.
And finally tonight, Pope Francis asked the faithful to contemplate the image of Christ on the cross.
Lui è venuto al mondo per prendere I nostri peccati su di sé.
At his daily mass at the Vatican, the Holy Father says Jesus came into the world to take on all of our sins, and we should make it a habit to look at the crucifix and remember our Lord's moment of utter defeat and suffering. It's not easy to understand, but we can contemplate, pray, and give thanks. And we thank you for watching tonight. For the entire EWTN News Nightly team, I'm Tracy Sable. We're back tomorrow with more news from a Catholic perspective. Good night and God bless.